Good evening. We would like to welcome you to our fauna webinar on degenerative suspensory ligament Desmitis, presented by Dr. Sabrina Brounts. This program is being brought to you by the Fauna Health Committee. With me tonight, as well as Julie Karpus, Chairperson of the Health Committee, and Jason Tice, Fauna Executive Director. We are recording this webinar and plan to have it posted in our library in the next couple of days. It should be also noted we are broadcasting live on Facebook. We will have a large audience with us tonight, and everyone will be on listen-only mode. We will stop periodically throughout the presentation to allow you to ask Dr. Brounts questions. To submit your questions, you can use the Q&A at the bottom screen toolbar. If you are on Facebook, please write your questions in the comments and we will try to get them answered. Now, a little bit about our presenter. Sabrina Brounts has a doctorate in veterinary medicine, a master's degree, and a PhD. She is a professor at the University of Wisconsin School of Veterinary Medicine. Dr. Brounts received her DVM degree from the University of Utrecht in the Netherlands. Isn't that convenient? She completed a residency and master's in science degree in large animal surgery at Purdue University in West-Lafayette, Indiana. Dr. Brounts was subsequently awarded a PhD at the University of Wisconsin-Madison. She is a diplomate of the American College of Veterinary Surgeons and the European College of Veterinary Surgeons. Her clinical experiences and research led her to pursue another certificate in equine sports medicine, and she became a diplomate of the American College of Veterinary Sports Medicine and Rehabilitation. Her research interests include soft tissue surgery and sports medicine of the equine athlete, such as lameness, ligament, and tendon healing. And Dr. Brounts has presented her research at national and international meetings and received multiple prestigious grants for her research in tendon healing. We are truly fortunate to have such a distinguished speaker this evening. Welcome to you, Dr. Brounts. We are so pleased that you are here this evening to present this important webinar for our fauna members. We are excited that you are well-versed in Friesians, given your heritage and your background. At this time, I will turn this over to Dr. Brounts.
Thank you very much. That's quite a biography there. Listen to that. So I feel humbled. Thank you for having me tonight. And you will learn with degenerative suspensory ligament disease, we do not have all the answers. So there is still a lot to do. And I just wanted to go through so far what we have done. So the main outline for the talk for tonight is, first, we're going to go over what DSLD actually is, right? A little bit, what does it present like? What do we know today? What can we prove today? Then I like to have a little bit of a break and we go then into genetic testing. So what is genetic testing? What's out there for horses? You know, how do you look at things? So a little bit of a background to that before we go into the third part of this talk, and that is about the DSLD research. And there is a lot of DSLD research out there. There are very controversial opinions, and my part will be mainly what we have done so far and what we think we could do in the future. And like I said, probably the rest of my academic career, I'll be looking into this, and I might not find an answer. It might be someone else that I have to hand over the baton since there's so much to do. So if we look at the suspensory ligaments, and in general, it is starting, and I hope you can see my pointer on the screen. Can someone nod yes? Can you see a pointer? Okay, yes. Perfect. So Here is the suspensory, right? It is that yellow structure right there, and it runs from the back of the knee or the back of the hock, and this is a front leg that you can see, and it comes down and then it attaches with branches onto the sesamoids right there, and then there's two extensors branches that come to the forefront of the leg. Those extensor branches usually are not a problem. We have nothing to worry about. But that back part, and especially the branches that attach to the sesamoids, those are the ones that usually get injured. The nice part about those ligaments is that there are collagen fibers in there, but the most proximal part that lies at the back of the cannon bone and in between those splint bones also has some muscle fibers. And that makes it sometimes hard for us in ultrasound exams to really see if there's something going on. The sesamoids right there. Or is there not something going on? So the whole function of the suspensory ligament is to prevent the excessive extension of the fetlock. So it holds the fetlock nice and up that it doesn't fall nearly onto the ground. If we look at injury, like I said, there are very distinct regions where suspensory can get injured. You have the proximal part, the proximal suspensory desmitis, that concentrates on the top. That's where also those muscle fibers are. You have injury of the body. Then you have injury around the fetlock area of the branches. And then besides that, that's just the desmitis. So there's an inflammation or there's damage or injury trauma to those parts. We have something that's called degenerative suspensory ligament desmitis. And that is a degenerative changes in the whole ligaments, not in just one region. However, it manifests, its most common region is the branches and just above that. So they're just a part of the body above that. That's where things are very obvious. That's where most of the clinical signs come from. But in that whole ligament, there will be fibers that are showing degenerative changes. So what about the history of DSLD? Well, in the 1980s, they came up that it was diagnosed in the Peruvian horse. And in that breed, they found changes in the suspensory that was mostly seen in Peruvians, and it was all spread out into that whole suspensory ligaments. So in the 2000s, it was the first time that Miro actually presented at the AAP a case study about Peruvians and what they saw. And it was, like I said, mainly Peruvian horses, and they didn't expect it to be too much in other breeds. After that, when we looked closer at it, we thought, it's not only in the Peruvian Paso, and especially in the Paso Fino, so those two gated horses, we also see it in other breeds. And the thoroughbred is one of them that we see it in. Some of the quarter horses, I've seen it in some Arabians, and the warm blood mainly these days as well. So anything that is a warm blood breed, especially that we have seen coming out of Europe, there are definitely certain families of warm bloods that show signs that are consistent with DSLD in their suspensory. There is a term out there that's called equine systemic proteoglycan accumulation, or ESPA, and that was introduced by the University of Georgia and that team. And they said it's a systemic injury. It's a systemic injury also to other tendons. They found changes in the nuchal ligaments, in the flexor tendons, in the eye, even in the heart. And there is some controversial opinions about that. There's not a true consensus if it truly is a systemic disease or not. So in some of the research that is shown today and what we have found, we might be leaning towards no, it's not. And so there's two camps out there, ones that think yes and others that think that it's not. So I'm not excluding one or the other. I'm more in the camp that it's not. So I'm trying to look for other reasons, but it's still out there. People still call it like that. And so that term gets used synonymous, DSLD or ESPA. Why is this important? Why do we want to know about degenerative suspensory ligament disease? The main reason is for owners. If you are buying a horse or you are selling a horse, you want to know, is my horse affected, or is it going to get this condition? You want to know as a breeder. You want to know, am I selling a horse that could get this, or am I having foals that are passing this along, right? Am I creating, so mom and dad are creating, giving this to their offspring? So that is important. And of course, for veterinarians, this is important, DSLD, because you want to make sure that you can help your clients, make sure that the health of the horse is fine, and that you diagnose it correctly. And this disease does get misdiagnosed a lot. So here's what it's all about. Here you see a horse on the left that is affected, and you see a horse on the right that is not affected. These horses are both Peruvian Pasos. So, and you can see in the little cutout that the horse on the left, you can see that fetlock is so tremendously dropped that the pasture is nearly horizontal to the floor, and that is very typical. Also, there's a lot of swelling around that fetlock that is also due to scar tissue that has formed. And the horse on the right side has nice pasterns, nice uprights, no swelling around the fetlock. And so that is the picture. We want a horse that is normal, and we would prefer not to have a horse that's on the left side. So how does it present? Well, there's no age, there's no sex predilection that we know of. However, we do know that horses that are 15 years or older seldom get affected with DSLD. There are the occasional ones that were like, hey, this is a weird one. And those are the ones that we really scrutinize and look closer at. But in general, the horse has not had any of these signs before 15 years of age. It's very unlikely that it will at an older age. Most of the horses are between the 10 and the 15 that will see it, but I have seen it as soon as a 6-7-year-old. So, but a lot of the horses, as soon as they hit the teens and around the teens, that's when things will start to manifest itself. There is certain breeds that we see that it happens more frequently in than in others. The Peruvian Paso and the Pasofino are two of the breeds, and the Peruvian Paso is one of the original breeds where they came upon this disease and in the 1980s. However, those breeds are not exclusive as the only breeds. So just because you are having a Peruvian Paso, you have a Pasofino and has a suspensory injury, doesn't mean that it's DSLD. So you have to be very, very careful with that. There are other breeds, Arabian, American saddlebred, quarter horse, thoroughbreds and warm bloods that I've seen that also have shown this disease. And especially in the warm blood breeds, we see a lot of it more recently, that things are happening that are very similar to DSLD. In this presentation, which is very, very weird and not consistent, is there's no history of trauma. So the horse has no history of trauma. There's never been an injury or anything that they know of, but all of a sudden that fetlock starts to drop really, really slowly, which is important because it's a degenerative disease, just like navicular syndrome. That is also a degenerative condition, and it slowly gets upon that horse, right? It slowly starts manifesting itself. That's the same with the DSLD condition. It slowly starts to manifest itself. So when the symptoms become, when the changes to the ligament become so excessive that the clinical signs happen, that's when we usually recognize it. And it doesn't matter that what the athletic activity is of a horse. It could be a horse that has never done anything in his life and all of a sudden gets it, to a horse that's been very active in his life and then all of a sudden gets it. So some other injuries on suspensory, it's the conformation, it's certain workloads or anything, you have a prior injury that sometimes presets that diagnosis that yes, you're going to get a suspensory injury. There's nothing like that yet in DSLD, not to say that there could be, and that's what part of our research will come in closer to that, can focus on, but there are some changes there, some other factors that we have to keep in mind that could maybe offset that disease, and all of a sudden it starts like manifesting itself, that we need to look into. So the gait changes are ranging from the horse is a little stiff, and when you get an older horse, right, not too uncommon that you have a horse that's a little stiff, to a horse that is so painful that it can hardly walk. And the lamenesses that you see go from very mild to very severe. A lot of times the changes that we see are in two limbs. It's either two hind limbs, the two front limbs, or in all four. It's mostly that I see it in the hind limbs. That's where it starts. Very seldom that I see it start in the front limbs. But I've seen just hind limbs. I've seen all four. I have seen one or two cases that I just had the front limbs, but it's very rare. I don't see it as frequently. The other thing that you see is the swelling around the fetlock. So there's swelling there, there's scar tissue there, there's inflammation there, it's painful when you touch them, when you flex that. So horses that, have to lift up their leg and the farrier is working, for example, to shoe the horse, they're having a little bit more pain there, a little bit more awkward. And when you put their leg down, they're kind of ouchy, and those are things that you will notice. As the disease progresses, what you get is the dropping of the fetlock. So you get that pastern going more and more horizontal with the floor, and you get that hyperextension of the fetlock. And then mainly the flexion, like I said, for a reason, picking out the feet or the farrier, that is painful to them when you manipulate it. So I've got some videos of a horse here that had a mild presentation of DSLD, and she is a Peruvian Paso. And so if you look at the first video, she is just walking, not too much going on. And you have to keep in mind the Peruvians are a gaited horse, so that's a little different than any other breed, but she's okay. She manages fine. She's not too bad with her hyperextension, and she does okay. She seems to manage fine with walking. Now, if we look at her trotting away from us, you can see not too bad, a little off, but overall, she's not doing too bad at all. I've seen horses that are a lot lamer that have a really hard time trotting. So she does okay. And especially the front feet in the Peruvians, it's definitely something that will grab your attention. So, and that's the normal gait for them. So she's not doing too bad. She's a little off. And it's weird for her to trot. So that's also, you have to keep that in mind. Now, now let's look at her when we flex her and what happens. So we flex the fetlock region in the front leg and we trot her off. And she did okay. She's like, yep, I'm okay. Not too bad, not too painful. She managed that very, very well. Now, if we look at the hind leg, she can hardly walk and trot off. She can't even trot off, and she has a very, very, very hard time with walking as well. So we do this again. We flex the hind limbs, at least one, and she has a very, very hard time. So this is not that it's like, oh my gosh, this is going to be DSLD because she does that. There are tons of other diseases that horses can flex like that, but you put the whole picture together and then things make sense. So in DSLD, we call it a presumptive diagnosis because the only way that you can diagnose this is once the horse is diseased and you get tissue and you analyze that in histopathology. So that's why we say it's a presumptive diagnosis, and it's a diagnosis of exclusion because you've looked at all other things. So the history is important. Gradual onset, depending on certain breeds are more predisposed than others. No history of trauma. So those are things that we look for. Clinical exam, the palpation of the suspensory ligaments, the lameness exam that you do, the distal inflection test. But the other thing that's very important to making this diagnosis, and as it is with all ligaments that you have diseases or injuries on, is imaging, and it's the ultrasound exam. And then finally, we get histopathology. And the most important thing about that is that you actually look at the suspensory ligament itself, and that will give you definitive diagnosis. There was a point that the University of Georgia will get biopsies of nuchal ligaments, and they said they could diagnose if your horse was DSLD or not. However, that test does no longer exist because the results were not reliable. So they got so many inconsistencies that they decided not to do that test anymore, and you can't submit biopsies anymore to Georgia. So as of now, there is not a test available that you can test if your horse has DSLD or not, except for the Peruvian Paso, and I'll get to that in a minute. So since it's so hard to diagnose, and only when your horse is deceased or euthanized that you can diagnose it, it gets misdiagnosed frequently. The ultrasound exam, like I said, is important. Every injury to tendons and ligaments, we look at it with ultrasound exam, and the same with DSLD. That is an important part of your exam that you need to do, and you cannot exclude that. You look at the whole suspensory. I always look at all the other tendons as well, the superficial and the deep, because there's a lot of times that other tendons can be affected, and it might not even be a suspensory ligament. And I've had that happen in previews that got presented for DSLD. And you always take two views, a transverse and a longitudinal view, and I'll show you those in a couple of minutes. What do we look for? Well, we look in the increase of size of the suspensory ligament. Is it larger than what it normally should be? Are there any holes, or are there any fibers that are torn and the fiber alignment is not nice? Is there a lot of swelling in between the fibers? There could be a big hole in there that is torn. And again, not very that it says, oh, that is DSLD, because that can happen in just normal suspensory injuries as well. But the thing that's important that I think, and this happens a lot in DSLD, is around that ligament is a lot of scar tissue. And I'll show you some pictures of that on an ultrasound. There is so much scar tissue that develops around that ligament well over time that is very characteristic and points more to DSLD than it does to other injuries. Again, it's not that you say pathonomic that is exactly DSLD, but you see it a lot more. In the Peruvian, Miro and others have certain measurements that they looked at when they diagnosed this and said, these are the cutoffs, what normal suspensory ligament measurements should be. And that's what we go for with the Peruvian, but we do not know any of this for other breeds. So here's an ultrasound exam on a horse that has DSLD. On the left is a normal suspensory. So down here is the bone, that white line, and just above it is the suspensory. I can actually see some nice fibers running through. I can see my check. I can see my deep. And I can see my superficial going up, but the suspensory looks nice and crisp. The fibers are running through, so I'm pretty happy with that. Compared to the image on the right, yes, again, I have the bone, but it's not as nice and crisp that the suspensory is running nice with the fibers. There's a little bit more space. The suspensory is a little thickened, and the fibers are a little bit more apart than they are on the picture on the left. Here is that was a longitudinal view. Here is a transverse view. So what we see on the left, again, is a nice suspensory that's sitting right there. And on the right, we have a suspensory that's larger, not as well defined as on the left side. So it's a little harder to distinguish what's suspensory and what is not. That was in the body. Now let's go look at the branches. And we look at a branch in a normal horse on the left, nicely defined, kind of a teardrop kind of shape that the suspensory has, and nearly nice and tight. Compared to the one on the right, it is all distorted, has holes in it. There's not real organization. And what we also see is on the left, there's not a lot of tissue between that suspensory branch and the skin, which is the top of the image. Compared to the right, there is a lot of scar tissue that you can see that sits on top of that suspensory ligament. So that suspensory ligament is pushed down due to the scar tissue. Now let's look at a longitudinal image, because that was the transverse. This is the attachment of the suspensory onto the sesamoid bones in that fetlock region. Very nice, attached, nice fibers, normal branch. Compared to here on the right, it's all wavy. I have scar tissue. I have a lot of edema. I can see big holes in that. There's a lot of not fibers that are torn. And so again, not a normal suspensory. And especially that waviness and that scar tissue is something that we see a lot in the DSLD cases. So as I said, the histopathology will give you your final definitive diagnosis. You collect tissue, you do histopathology, you send it and look under a microscope. And that is what you will find then if your horse has DSLD or not. Unfortunately, the nuchal ligament biopsy is no longer available. And what we're looking for is the accumulation of proteoglycans and the scar tissue that increases. So if you look at histopathology, on the left, we have a normal suspensory ligament. And so we can see very nice fibers and then divided by normal fibrotic tissue, and the stars in the middle where you have some vessels and some fibroblasts sitting. So very nice and organized. Going to an abnormal, and this one is highlighted for the protein glycan accumulation, we can see all this purple sitting in between those fibrils that should not be present. And some people say, at least we know in human medicine, the accumulation of proteoglycan is a sign of injury to a tendon of a ligament. So we don't know exactly if this is the cause of, due to, do you have that you get a tendon or in a tendon that is more weak and that's why it will get injured, or is it that proteoglycans accumulation happens because due to an injury that happened to the tendon. So it's kind of the chicken and the egg situation, and we're not really sure. So in human medicine, they say injured tendon or injured ligaments have a lot of protein glycan accumulation, and they think that is a cause of injury. So again, in DSLD, it's not really clear, and we're still looking into that. And then on the most right, we see, again, the fibrils, that all the nice tendon tissue, but we see a lot of the pink that is the scar tissue that has formed in between compared to the one on the left, where you hardly see the scar tissue in between. You just see the normal fibrotic tissue, and that's become really excessive when you have a horse that has an injured suspensory ligament that is affected with DSLD. Other tests that have been done to figure out, is there anything that we can do? Well, there's a paper out there that I have done with a group in Chicago, and we looked at getting fibroblasts out of fat tissue and see, like stem cells in that region and the fibroblasts. Is there anything we can get from that we could compare to horses that are affected and horses that are not affected? We did it in Peruvian Pasos, and we did find there are some differences when you culture those in a petri dish and you look at the growth factors, that there is a difference between the controls and the cases, but it's not clear cut, and it wouldn't be definitive for a test. Then there is from the group in the University of Georgia, they thought, well, maybe we can take skin biopsies of these horses, right? They are more on the belief that it is a systemic disease. It might have similarities to Ehlers-Danlos syndrome. So can we just take skin biopsies and then look at the RNA in that and see if there is anything in there? So they did. They looked at growth factors and especially BMP2. They found that there was an increase of that in those skin biopsies, but it wasn't as consistent as they had hoped for. So there's not a definitive test. I can't say we can make a definitive test with that, but they did said, all of the growth factors that they found are very, all have a association with the extracellular matrix. So the matrix around in the tendon, around the cells, that is all manipulated by those growth factors. So there has to be something that is in those growth factors that makes that matrix where those tendon cells live in, that something changes in that environment that makes that tendon do what it does, and it becomes a disease that is degenerative. Are there any treatment options? That's what all the people want to know, right? Can I treat this? Can I do anything? There is no curative treatment as of now. So if your horse is diagnosed with this, it is a disease that's progressive, and the horse will eventually get worse, and you will have to make a really tough decision. So it's a devastating presumptive diagnosis for the horse as well as for the owner. The main thing is about trying to slow it down and make this horse comfortable. And it depends on what stage the horse is clinically, how comfortable the horse is. And the main gist of the treatment or slowing this disease down is pain management. So you go to systemic pain management, you give it some and some pills like, you know, bute or Banamine or virocoxib like Equiox. Those are things that you can give that helps with the pain, and they've been proven to be very effective anti-inflammatory agents. In very severe cases, we have added gabapentin to help with the pain in horses that are towards the end of the disease, and to still make them comfortable. Also, locally, you can do something. There's Surpass cream, diclofenac cream, that has a local anti-inflammatory. So if you have a tendon that is a little bit more swollen, you can put some of that cream on there, and you can use the local treatment with Surpass in addition to the systemic that you have with their pain medication there. So you can use them together. The people have asked me if bandaging the limb is okay to do, and yes and no is the answer. Yes, it definitely will give the limb support, but you also have to be careful that you don't keep things bandaged all the time, because it also weakens things. You still want to have that tendon keep some of its own strength. So getting some of the swelling out and giving a little bit of support, I'm all in favor of that, but I don't recommend bandaging the limb all the time. So I tell people, like, you know, bandage on and off, like 12 hours on, 12 hours off, or a day off or a day on. So don't always have bandages on 24/7, because I don't think that's going to do that tendon or that ligament any good. Exercise. What can the horse do? Again, it depends on how advanced the disease is for that horse. We do know no stall or rest, that is for sure. So don't put the horse in the stall and say can't do anything anymore. It does need some exercise. So, and it's been proven, there was a group in the University of Louisiana that looked at Peruvian horses that had DSLD, and they put them on treadmills and they looked at them over a period of time. And they saw when the ultrasound exam that the horses that had mild exercise, so they had 30 minutes of exercise 2-3 times a week and not very deep footing, that they actually improved clinically. On ultrasound, the fibers became more organized, but the position of the fetlock never changed. So once that ligament has been stretched, it won't go back to its original state, but the horse does get more comfortable when they did that, and the ultrasound looked better, but the dropping of the fetlock stayed the same. So that part, that stretching out of that ligament that happens, that fetlock that drops and the pastern becoming more horizontal to the floor, that will not reverse, but the horse will get more comfortable. So I think, therefore, it is important to have mild exercise and consistent exercise, and don't overdo it. And that will keep that horse going for a longer time. But just make sure that they're not in deep footing, because in deep footing, tendons have to do more work. And so you don't want to overstress that. The last part of that as well is then shoeing. Depending, again, how advanced your DSLD is, it's always good to have good shoes on, or good trimming done. You want to make sure the foot is balanced. The inside and the outside should be the same length, not one higher than the other. You want to make sure that the toe is short so we can ease the break over, puts less strain on the hind of that foot and all the tendons. If the horse is in an advanced stage that it's dropped, you can put some egg bar or hard bar shoes on that have an extension that will help with lifting that fetlock up a little bit more off the ground. But as the disease progresses, those won't work anymore, and that will not work. It will work in the beginning stages, but not at the end stages of this disease. And of course, make sure that that foot stays nice and balanced very frequently, that you get trims done, because if you neglect it and the toe gets too long, again, it doesn't help the tendons. A lot of people ask me about the regenerative medicine, and it's a hot topic in tendon and ligament disease. And I just recently gave a talk about that in general. But for DSLD, I don't have the answers to that. I've never treated a DSLD case with this. And a lot of times, Regenerative medicine is used in acute injuries and tendon injuries. And so you have a very distinct lesion in a region of a tendon that you inject. So DSLD doesn't present that way. It's usually a degeneration over the total body of that ligament and the branches. And by the time I usually see it, there's a lot of scar tissue, so I can't take that away. So I do not know if regenerative medicine would be an answer to here, and that's something that still needs to be looked at. Same with other treatment modalities, right? There's shockwave therapy out there, laser treatment, magnetic treatment, acupuncture. I don't know if it will slow down the DSLD, the changes to the ligament. I don't know if it will reverse things, and I doubt that, but I can't say yes or no for sure because you need some proof for that. But what I do know is that, for example, MagnaWave is very relaxing to a horse. Acupuncture can help with pain. Laser treatment can help with pain. So shockwave treatment also helps with pain. So these modalities can help to make that horse more comfortable. And I think these modalities probably have a better effect when you treat it in the beginning of the disease, then you go more towards the chronic stages of this disease. So again, when you use it and what time and what point of the disease process, I think is very important if you'll get the effect that you want. And then unfortunately, euthanasia is a treatment option. You know, you get to a point that it's not comfortable anymore for that horse, and it's not the horse that you had, and you see how much pain that horse is in. And then it's the most humane thing to do is to euthanize your horse, because prolonging its life is thus not a fair thing to do to your companion. So it is a treatment option. It's not the first one we want to go to, but there's a lot of times that I just see the end stages, and then that is the option that most owners, unfortunately, then choose. Are there any questions so far before we move on?
Yes, there is, Dr. Brounts.
Ooh.
So question number 1, what are some of the other diseases that may look like DSLD?
Okay, so any injury to the tendon, to the suspensory ligament, can look like DSLD. So proximal suspensory desmitis, it can look like DSLD. If you just have an injury to a branch, can look like DSLD. The difference here is if it's just only to that part of the suspensory ligament. So it was only between the splint bones and the most proximal part of the suspensory, and the branches look fine and everything else look fine, then I would say it's not DSLD. If only your branches are affected, but the body just proximal, just above that, the distal part of the body is not affected, then I would say it's not DSLD. So it's important to look at the whole suspensory ligament and put an ultrasound, all of that, in conjunction with the history and the clinical presentation that will rule that disease in and out. There are definitely gray areas, right? Not every horse declares itself from the get-go. So if you have a horse that you don't think has DSLD, but as you treat that horse or you're doing things are not getting better, but things are getting worse, and you know that you are following strictly the protocol that the veterinarian says, and you're doing everything correctly, then you might want to question yourself and say, hey, why is the ligament deteriorating over time? And why am I not getting where I want to go? And I'm doing everything right. So is there something else that could be due to this? And then DSLD pops up again and says, hey, could it be this? Does that answer the question?
Thank you for that. We have 3 other questions.
Okay.
The next one relates to farrier care and positioning while you're doing farrier care. So let me just go through and actually read it to you. Regarding pain during farrier care, would it be more painful for the weight-bearing leg, and then they need to rest that leg when the other is set down, or is it more painful for the leg that was being held up and fetlock flex for trimming, then that leg would need to be rested then when set down? So I guess it's looking at the sequence of how you do farrier care with these flex positions and such. What's the most comfortable way to manage the horse?
So usually the flexion of that fetlock will cause more pain than the not flexion of that fetlock. What you'll have with a horse that has the disease, as you pick up one leg, that fetlock will drop more on the leg that's bearing weight. But that usually doesn't hurt as much as the flexion of that leg. I can't ask the horse, so I don't know for sure, but how the horse reacts and what I see, that is my feeling that that's what's bothering the horse more. So if you have the horse flex for a long time, and with farrier work you have to, and you have a horse that has an injury to the branches of the suspensory that's not DSLD, or it is DSLD, you might have to put that horse's leg down multiple times while the farrier is working on that horse, just to make sure that horse stays comfortable. The other thing that you can do as well is if you have DSLD horses and you know that it's going to be a very painful thing because the farrier is coming out, you can actually give them some bute ahead of time with a little higher dose so that they feel more comfortable and it won't affect them as much. And so that helps as well.
Great tips for that. Next question, would an equistride device help a horse with DSLD? They're typically used for suspensory ligament injuries.
An equistride device. I don't even know what an equistride device is.
I don't either. Laura, if you could type in a little bit more detail on that, that would be helpful. And while we wait for Laura, there's another question from Scott. What is a typical rate of onset for the disease DSLD?
So I've had horses, once I've diagnosed them, within a year, they are euthanized. But I also have a couple of horses that I've diagnosed 2 years ago, and they are still doing fine. So, and that's where the difficulty comes with this disease, and we'll touch base on that as well. It's not all genetics. There's a lot of other factors that have an influence on that. So, and we'll get into that. So a lot depends on what age and what kind of environment the horse is in. And so, and that will become clear in the rest of the presentation. So you can't say, and I've tried to predict, and I can't predict it. And that's the unfortunate thing, because that's the question I get asked the most, how long does my horse have? And I can't tell them that. I don't know. Every horse is different.
Okay, thank you for that. That's all the question. Whoops, I think there's another one that came in. It's Lara. Thank you, Lara. The equistride device is a fully adjustable support system for the distal limb. It can help the horse through all stages of tendon and suspensory ligament recovery. It's a fairly new tool for these types of injuries. So it's a fully adjustable support system for the distal limb.
So if it's more like a support system on the back of the leg, so the fetlock doesn't flex us all down, then maybe yes. But if I'm thinking the equistride device is mostly put on in injuries of the suspensory when it's painful for them. And so it helps them not to injure it more, which could help in DSLD cases. But I can't say if it works or not, because like I said, I don't know the device. I've never used the device. And I do know that some exercise and normal exercise and flexion and extension of that fetlock is normal to keep the strength of that ligament. So you don't want to limit it too much, the same as the bandages, don't leave them on all the time. So I think if you use that device and you use it cautiously and not have it on all the time and give it at least some support for a period of time, maybe it could be beneficial.
Okay, thank you for that. And Lara also added, it's the only device where they can exercise. It's quite neat, she says.
Okay, I'll look it up.
Thank you. Okay, that's all the questions so far, Dr. Brounts.
Okay. So the main question that we got from a lot of the Peruvian horse owners, and that every horse owner has, or a horse breeder has, when there's a certain disease that happens more commonly in certain breeds than others, is there a genetic test available, right? Or can we create one? Well, this is just a sample of what's out there. If you Google genetic screening in horses, there's tons of tests out there, and more companies that pop up that say, I can do this, and I can test you for this, and I can test for that. And so and not only equine, small animals even more gone overboard with all these testing than we have in the horse world. So there are many tests out there in horses. There are tests that you can have for specific diseases. There are for specific neurological diseases, for certain immune diseases. Some of these diseases, what we all know is, HYPP in the quarter horse, HERDA, that also has a certain breeds that get that more frequently. Lavender foal syndrome, those are specific diseases that they can test for. Then there are tests out there on the market that can test for a certain coat color. So can I predict if my horse is going to get this color? Yes or no? There's a Shetland pony coat color test that I found out that I didn't even know about. So that's the tests that are out there. Then there is a performance testing that's been done, and that's mostly common in thoroughbreds. We see that. People want to know, is my horse going to win the next Kentucky Derby? So certain genetics, maybe we can predict that they have better racing distances, they can do it longer. There's horses that have certain gatedness. They want to see, is it more pronounced? Is it on the gait that I need in this horse? Is it going to give it to its offspring? And then there are tests out there that say my horse is from a certain region, or my horse is from a certain amount of breeds. I don't know what kind of breed my horse is. So what kind of breeds are in my horse? Like, is it more a thoroughbred? Is it more a quarter horse if you don't have a purebred breed? So yes, there is a lot out there. This is just a sample of a book that I have, and this is just a small sample of all these tests that can be done. These are the tests that they have found so far, what the disease is, which gene is affected, what breeds are mostly affected. They found out what the mutation is. So you can honestly test and say, yep, my horse has it, or my horse does not have this. If we look at the Friesian, since I'm presenting for you as the Friesian Horse Association right now, there's 3 that are very defined in the Friesian horse: dwarfism, hydrocephalus, and dystasiasm. So those are the 3 that can be tested in the Friesian horse, and they're all autosomal recessive genetic diseases. So these diseases follow the Mendelian way of inheritance. They are recessive, so my horse has to have both parts of it. So it has to have from mom and from dad, and it's not associated with the X or Y chromosome. So I get something from mom, I get something from dad, and if I have them both, that's when I get the disease. This, in the majority of the diseases that we see, they're all recessive diseases, and they all follow the Mendelian path. That's what makes these diseases so easy to find. And that's what most of the diseases that I showed you on that list are all following this path of inheritance. So it's in purebred horses, so it's easy to test. You have to have something from mom and something from dad to inherit it, but you have carriers as well. So mom has it and dad doesn't. So those horses need to be identified because they can bring it on to their offspring. And so the disease then stays into the population. So that can be easily identified as well. And you only need a small number of horses to identify a disease like this. So I say recessive diseases, if you look at this tree, are the low-hanging fruit. Those are easy. Those are very easy. You can find them really easily, and you don't need a lot of horses. Then if you look at the dominant diseases and you look at the complex diseases, those are not the low-hanging fruit. And the complex diseases are the stars, right? There's a lot of things we need, a lot of samples for that. So if with a recessive disease, you need about 20 horses to figure out how it inherits. For a dominant disease, you need about 50 horses. And if you want to look at a complex disease, you need in the hundreds of horses to figure out if there is something. And genome-wide association studies can be used for this. They are very effective in dominant and complex diseases. And what they do is they go through the DNA and find locations in that DNA that say, hey, this is different between a case and a control. You need a lot of horses to find that out. In addition, because it's not a Mendelian disease of inheritance, the statistical methods to figure this out are very, very complex. You need a team of people. and they're very difficult statistical methods. So it's not easy to look at diseases that become more complex. So it's not a single mutation with complex diseases. There can be variation genetically in there, and there are different variations and different genes and factors that if they all come together, I get this. And if they don't all come together, and I only have 50% of the factors coming together, I don't get the disease. And that makes complex diseases really, really difficult. So just to give you an idea how this works, here you have the scale of life, and the dog on the left doesn't have the disease. But if he has a Mendelian recessive disease, just one change in its DNA, and that's what that ball represents, will have the dog get the disease, right? So that animal gets the disease if we have just one mutation that happens. Very simple to figure that out, not hard, and you can do it with not a lot of horses or animals. Now let's look at a complex disease like DSLD. We have not one thing that changes, but we have multiple things that change into the genetics of that animal. And when they all come together, that's when things happen. So 1 or 2 mutations, no. 10 mutations, still nothing happens. But when I reach a certain 50 mutations, then all of a sudden, disease manifests itself. So it's a little different than the Mendelian disease where you just have one. Complex diseases also, what's important here, the environment makes a difference. For example, in human medicine, pulmonary carcinoma and smoking are very much associated. If you are a smoker or you are around people that smoke a lot and you inhale that a lot, that environment will make you have a higher chance of getting pulmonary carcinoma. Same with melanoma and UV exposure. So besides that, you need multiple genetic changes, the environment that you're in and the environment might change things in that also that can make the disease become manifested. So again, makes it harder to figure out, why does my horse get DSLD and the one next door does not get DSLD? The other thing that we'd like to do with complex diseases is there's a heritability factor that you can calculate. So what it does is that it calculates the proportion of disease risk that can be explained by the genetics alone. So I know a complex disease has an environmental factor and has a genetic factor, but which one is more? Is it more the environment or is it more the genetics? And that's what heritability will tell me. So it's a number between 0 and 1. And the closer I get to 1, the more the genetics is important. And the closer I am to 0, the more the environmental that animal is in is going to be important and not as much genetics. So this is just a scheme that you can see that Mendelian diseases, the one mutation, it's all genetics, right? There's hardly any environment involved. But as you go more towards the infectious disease, and especially the complex diseases that are in the middle, it depends on where that heritability factor is, how much is environment and how much is genetics. So if we really look at DSLD and the complex disease, and we get back to this animal on the scale of life, it's not only all the M&Ms that are in there, and that's the genetics, it's also the bones that we're throwing in there that is the environment that comes into play as well. And that's what makes this disease so hard. So why do we study these diseases? Why is it so important? They are more common actually than the recessive ones. You just don't, it's a little bit more work to figure it out. So if you look at all the diseases that we have, complex diseases are more common than the simple diseases that have Mendelian, but a lot of them, the Mendelians are easy, low-hanging fruit, and the complex, it does a little, it's a little different. The other thing why it's important to look at these diseases is, can we modify this disease somehow? So is there anything that we can do, maybe in the genetics, but actually more in the environment, that we can modify that disease and slow it down? Maybe in the genetics we can reverse it. So hard, but it's more about the environment. Is there anything we can do for that animal in its environment that we can modify that path of that disease is going to follow? And the last part is that why it's so important is the prediction, right? Is my horse at risk or is my horse not at risk? And if my horse is at risk, I'd like to know what I can do to decrease that risk. So the genetic testing and the risk assessment and the prediction of risk is something that we can give with complex diseases. Any questions so far before we go back to DSLD?
I have one, Dr. Brounts. So does this relate to that incomplete penetrance that has been spoken about, that you could be a carrier, you could have the disease, but it doesn't manifest itself because you don't have that coupling of the environmental factor with that genetic factor?
Right. So the incomplete penetration means penetrance means that you could have things, but it doesn't show every time the same way, right? And that's when the environmental comes into play. Yes. So
Okay.
you might have all the genes, but because of the environment is so good, actually the disease might not show up. And so, yeah, that is possible. Only that environmental factor is a lot stronger in complex diseases than it is in some of the Mendelian diseases that also have that variability. So, yep.
Thank you. We're good on the questions.
Okay. So going back to DSLD, what we have looked at so far at genetic wise is we know there is no single cause. If I had that, it's not following the Mendelian spectrum. So we looked in that, we were hopeful, and unfortunately we were disappointed. So there was already the suspicion of others that had done that, but we had looked at some other things and like, nope, it's a complex polygenic disease. So we know, looking at this little foal, is whatever mom and dad gave them in confirmation, whatever the genetics that it got when it was born, those are for our influence. We know the environment, how the feet are trimmed and the farrier work, what is done. How quickly do I train my horse, right? Are I very early with the training, or are you very late with your training? So are you training a 2-year-old already, or are you training a 4 to 5-year-old? Weight, body condition. Do I have a very obese horse, or do I have a skinny horse? All of that has an influence on what those tendons for strain are getting. And then there are also things, horses that have Cushing disease or insulin resistance and metabolic problems, they also have degenerative, well, they have changes to their suspensory that are suspicious to be degenerative. And there's a couple of articles that came out in recent years that show that. They haven't exactly said it's DSLD, but they have said there are changes to the suspensory, and it could be because of the horse being its internal environment. There's so many steroids that it gets exposed to, and that's is exactly what we see in humans that also have a lot of steroids, either given steroids or their internal steroids, are very excessively, and they have changes to their tendons as well. So there is a connection that needs to be investigated a little more to see if these horses are more prone, because they are in that environment that makes that suspensory lose some of its natural ability. So what we did is we looked at breeds that we are known in the literature that have been reported to have DSLD or have a risk of DSLD, and what that risk is. So this is a table of all the breeds that we looked at and that we know of what their risk assessment is of getting DSLD. So we know the Shetland pony is nearly 0. We know the Icelandic horse has not had anything, or Welsh ponies, but we know the thoroughbred is a medium risk, the standardbred is a medium risk, we know the Arabian is a low risk, and the Peruvian is a high risk. And those were all DNA that we could get from other laboratories that we could work with. So here, looking at this, we tested a lot of breeds. We looked at a total of 466 horses. We looked at 10 different breeds, and we classify them as either low risk, medium, or high risk, or they were a control and there's no report of them having DSLD. So, and where all of those were classified, and all of that DNA we looked at and tested it. What we found, if we looked at this, that the Peruvian horse, and that's, we got into this because of a client of mine that has Peruvian horses, the Peruvian horse and all horses, if you look at the nice circle on the left, are all related. So, and we looked at first 1 and 2 generations back of horses, and we see that there is some relationness of every horse and the breed together, and you can see all those lines, how that is. However, we clustered the breeds in a different way and how familiar they were. We could see that the dark red purple here is that the Peruvian horse is very much a breed of its own and doesn't have a lot of breeding with the other breeds within it. So if you look at all the other breeds, you know, except maybe the Icelandic or here the Shetland pony, but all the other breeds, there's a lot of other breeds that have gone into way back in that horse that made it the breed that it is today. So, and that is harder for us if you have a breed that has a mixture of some other breeds in there, because those genetics come into play then as well. But we found that the Peruvian is a breed on its own. It stands very separate from the rest. So that was good to know. So we did a genome-wide association study. And so what we're doing is we're looking at all these breeds and looking and see, are there any markers in their DNA that might point to certain locations in the DNA that there might be something between the horses that are affected and the horses that are not affected. So in general, we found 151 spacers or loci or places in the DNA that are different between those different breeds, between low and high risk and control and all of, we compared all of them. Of those places in the DNA, if you look at those, look closer at them, and you look at all the genes that are associated in that, there are 46 candidate genes that could be interesting that have anything to do with tendon or tendon surroundings or environment and all of that. And the majority of them are related to aging of tendon, how the transduction happens in there, the collagen, how that's made, and how it responds to certain stimulants such as oxygen, not getting enough oxygen, or the lipids. And then the lipid metabolism comes back, it's interesting with the PPID. We did find that proteoglycan turnover was not something that came up. And so that's what others had seen, but we could not find any candidate genes that had an association with that. So that was something that we're like, well, you know, maybe it's new, maybe it will come up on something different. We have to look at that a little different. The way that you look at this is on the Manhattan plots that you see here on the right. And these are just a couple of comparisons. So anything that's red means that it's interesting to us. So you have a certain level that all these DNA has to surpass for us to become interested in a certain spot. And so you compare the high to the medium risk and the high to the low risk, and then the high risk to control. And that's what you do. These are just like some of examples. And so, and when we make the bar even go higher, we have a certain bar that you have, and then you get a lot of red dots above the line. But if you then go higher even, and you want to look more specific, then you teeter out a lot of them. And then there's just a couple that stay. And then you go look closer at, you know, for example, on the middle bar right here, it looks like chromosome 2 and chromosome 7 and chromosome 5 are important in this one, just in the end. And so then we go look at that chromosome a little closer, see what's on there for genes and everything, and which of those genes are then specific to tendon. So there's a lot of research that goes into it to look and see what's important for this disease. So we find that out. We have 46 candidate genes that could be of interesting if we looked from between the Peruvian breed that is at high risk, and we looked at the other breeds that are at low risk, medium risk, and no risk at all. So we're like, okay, then what next, right? Well, those candidate genes that we found, we had to look more within the breed of the Peruvian. Can we specify more clearly which ones of those are going to be important to us? Can we predict the heritability, right? Is there any kind of things that we can say, this is more environment, this is more genetic, how they're passing this along? And then can we develop a test? So, and we call it a polygenic risk score. So it's a risk score of my horse is more at risk, or my horse is low at risk or medium risk. Is there something that we can get if we look specific at the Peruvian breed that we can test for? So we actually did. We did a GWAS study and some other studies to look at the Peruvian horse specifically. When we looked at the heritability, we looked at nearly 2,000 horses, and we had all these pedigrees that we asked when the horse was part of our study, and we had 963 females and 607 males. There was a little bit of inbreeding, about 6%, so we took that into consideration into our calculations. And we knew of exactly what the horse looked like, if it was a DSLD horse or not a DSLD horse, and nearly 350 horses. So there's a lot of calculation that goes into this. And that's why, like I said, there's a whole team of people that I work with in our lab that helps us with this and does the calculations. And what we found is, you can see this curve here with the blue lines, that is where the heritability is for all these horses and where they stand. But if you look at exactly where the mean is, and it's about at 0.24, nearly 0.25, that where the middle is of this curve. And so what that means is, remember, heritability is a number from 0 to 1. The closer we are to 1, the more is genetic. So if you see 1 as 100%, then my number for the Peruvian, for DSLD, is 0.25. So that means 25% is from genetics, but 75% depends on the environment. So the environment, again, is very, very important in where this animal is and what you can do to prevent, if it does have that 25%, then, you know, can we make it not manifest itself as quickly, or maybe not at all? So that was important to note. We didn't know that before. And so when we look further, we did a GWAS just in the Peruvian horse again to look at DNA of the Peruvian horse, and we got more horses. We looked at nearly a little over 180 horses, and we knew exactly which horses were affected and non-affected. And so we had looked at them, we looked at their age, we had looked at their medical records, we took photographs of them, there were ultrasound exams, we worked with veterinarians, so we knew exactly of these horses where they stood on that whole spectrum of DSLD. Then we collected their DNA. We started out with nasal swabs, but it didn't turn out to be too productive for us, and we got a lot of false that we can get a lot of DNA. So we switched to hair, and if I saw the horse in the clinic, I would draw blood, and we sent that off to get the DNA. So here we go, and we looked at this, and we got a Manhattan plot again, and the red line was the one line that we set that was very important for us. Anything that became above that was what we looked at, and we found that on chromosome 4, 10, and 11 were some spots that were very interesting to us. And we looked at those chromosomes, and we looked at those closer and looked what kind of genes were in there in those spots. And again, coincided with extracellular matrix and signaling, how signaling transduction was within cells, which we found on our previous study about different breeds. But this time around, we did glycosaminoglycometabolism was found. So that was interesting because we didn't find that before, and we did find it here. So we're like, okay, so again, the metabolism of glycosaminoglycan is important, but we don't know if it's because of the injury or they can, you know, take it away and they can get rid of it and then it stays. So that's still something that we need to look into. We did a signature selection, and that's looking a little bit more with a different statistical method, looking into some of these genes more closely. And then we found of those 200 that only 66 were only of real interest to us. And in those 66, there were 2 that came out that you see right here that had never been reported in any tendon injury before. So we're like, okay, that is interesting. And maybe there is something unique here that we need to look at. So TGFB3 is something that we see in tendon injury in humans, not in animals. It's not been reported in horses. That happens with aging of tendon, has a relation with aging of tendon, and the turnover of collagen once it's injured, that is defective. So that is very interesting here for this disease. And the GLI2 is part of a pathway called the Indian hedgehog pathway. And that has to do, again, with the environment of the tendon and the mechanotransduction. So we're like, okay, this is interesting because it fits with how the disease presents and has been seen in humans. So again, the human and the horse with the One Health medicine that we try to practice at times, this could be of interesting. And these genes had never been reported in horses before. We also came up with a test for the Peruvian because we found that with the genes that we could identify, we could classify the horses into either you're a case or your control, or where the probability is in between and where you lay. So we developed a test with the different genes that we have, and also the sex of the horse was an important thing that we found out. The limitation is this test is based on only 183 horses, but we still, with that amount of horses, we still can have a 92% accuracy of where your horse will fall. And we are still, recruiting horses for this because we will redo some of that testing as we gather more horses because we'd like that accuracy to go up. So as we collect more horses in our control population and our case population, our accuracy will go up. And this is the scale that the owner will get back of where you fall. So just to give you an example on what that looks, if you look on the left side, this is the cases are in red and the control population that we have is in blue. And that's the population of horses that we know, and we know for sure their cases of control. So your horse that you give us DNA of then gets compared to those two populations, testing populations. And if you look at this horse specifically that's with this arrow, it means that again, it's about a 67% chance that this is a case and a 33% chance that it's not a case, that it's a control. So the line between here, between the two cases, it's far away from a case. So that's the longer haul and it's very close to here, but it's 67 here and 33 here. So it's more of a case than it is a control, which makes it look confusing when you look at this, because you would say, oh, it falls within the control, right? It's in that little quadrant right there. No. It's the distance that it is away from either population. So it has more cases genetic than it is control, compared to the horse on the other side that has a 57% that it is a control and 43% that it will be a case, the risk. So when you get a horse that's very close around the 50%, those are the ones that are very hard. And some of them are very obvious and some of them, they're not very obvious. So what does we need to do for the future? Well, first of all, we've got this test right now. So what I'd like to do is with this polygenic risk score test that we have is I would like to follow those horses that all have been studied, and we can test a horse when it's already a foal or a yearling. So the age doesn't matter. I'd like to follow those horses over time and see what the results that we have. Do they develop it? Yes or no? And if they do, I want to know everything about the environment. And we have a really broad questionnaire that we've developed to ask you everything about your horse and the environment of that horse. So I would also like to go back and look, now that we know what the heritability is in the Peruvian horse, to go back to the questionnaires that we have of all these horses that have participated and see if there's a common denominator in the environment. Is it something in the food? Is it something with when they train them and at what age? It has to do with shoeing. Does it have to do that they might have Cushing's or not when that was diagnosed? So that is important that we look in as well. We still have a lot of tendon tissue that we've collected. So we are going to actually look at that tendon tissue as well and do some testing on that with RNA. And eventually, once we know further what the genes are and the pathways that we're looking at that we can influence, maybe there is something that we can do to modify the disease, or maybe there's a way of treating the disease depending on what we find. But genetics wise, it's only 25% and 75% is environmental. So the environment that the horse is going to grow up in is going to be very much of influence if this horse gets DSLD or not. And we just have to find out what in the environment makes this trigger this horse to get the DSLD, and what can we do to prevent that. This is all Peruvian horse that we've done so far. We have a whole database, and we've been collecting samples of horses that are not Peruvians that are also been diagnosed with DSLD. So what we've done in the Peruvian is something that we would like to repeat in other breeds. But some of these breeds, like you have shown you in that cluster diagram that I showed you, have a lot of influence from other breeds, and that makes it harder because we have to keep that into consideration, and that there's a lot of different testing then that we have to do. But eventually we'd like to say, hey, we can have a polygenic risk score test also for other breeds. We'd like to know what the heritability is, so we know how much environmental, how much is genetics. So there's still a lot of research to be done. And unfortunately for us, research takes money. And so as of now, we're looking for new sources of money and writing new grants so that we continue this research and hopefully find more answers. So in summary, DSLD, it is a progressive, it's a debilitating disease, and it happens in a lot of breeds of horses. So it's not specific to one breed. The diagnosis is very, very hard because it mimics a lot of suspensory ligament diseases that are not DSLD, and that's why it often gets misdiagnosed. There's a lot of breeds that see it more than other breeds, and just because it's the breed that it happens in a lot doesn't mean that it's always DSLD, so be very careful with that. DSLD is complex. We found out, we know what it is, the heritability, we know what that number is, 0.25, and we know that there's a high environmental influence. So especially in the Peruvian horse, so maybe similar in other breeds, but in the Peruvian horse, that is the case. And there is a polygenic risk screening test that we have available at the UW for the Peruvian horse that we can do. And so we can tell you what the risk is in your horse, and then hopefully over time we follow your horse. And it's 92% accuracy, so that's pretty accurate. And future research in other breeds, I think, is necessary, and hopefully that we can get to that and we can figure things out. That is it.
Well, Dr. Brounts, no, it's not, because we got some questions for you.
Well, this is my part so far.
You've got people thinking. Question, this may be planned to cover already, but just in case, could collagen supplementation be beneficial?
I don't know. And that is a good question. I don't know. I usually do tell my owners that have any tendon and ligament disease or injury that I think supplementation is always beneficial, right? So, and I do the same with my DSLD cases, but I don't know. There is definitely the genes that we're looking at are in the collagen pathway, but we don't know exactly how or what it exactly does. And that's where, we have to dig deeper. We've got this whole net, and we're getting closer and closer in this funnel until we get to what we want. So we spread out our nets and we try to constrict it. And so, yeah, possibly, but I don't have an answer.
Okay. Well, and maybe more light will be shed once you get those surveys back on environmental factors in terms of the intake, the nutrition of those horses too, which would be interesting to see in the future.
Right. There are definitely some, so suspicions, and I have to, like I said, think a lot of this is due to the Peruvian Horse Association that we work really closely with. They have been very, very gracious to us, and they've done a lot of things of recruiting horses for us and people, and it's a very controversial topic for them. But I've worked with their leaders in that association, and they've been very good to us. And of course, my lab that I work with, the comparative orthopedic lab here at the UW, there's a lot of people in there that we work closely with. And it's, like I said, it's a team effort to do this research, because there, we all know a little bit, and we put that whole team together, and then we come up with the results. So thanks to all these people that have worked with us on this, this has so far been possible.
Exciting work for sure. Another question, are there many Friesian horses that have been diagnosed with DSLD?
No, I have not had a lot. I think I have 1 or 2 in my database, but no, I have not had a lot of people that with Friesian horses be part of the study.
If we do identify horses, and we have had some of our members reaching out to us with DSLD cases, is that something that you would like to connect with those types of individuals in terms of expanding the breeds that you're researching or looking into?
Absolutely. So my email is on here on this slide. So if you have a horse that is suspect, email me, and then I will ask you a lot of questions, and you'll get a lot of information. But the main thing is, I need a whole exam done by a vet, or what's previously done. I need the long history. You're going to get a questionnaire with everything about that horse. What does the vet see? What's the lameness exam look like? What does the ultrasound exam look like? So those are all things that we'll take in consideration and look at, yes, before we submit a horse to our study. So all that will be needed, and that's all what we would like. And then we take pictures and all of that before we ask for the DNA.
Good to know. Thank you, Dr. Brounts. I think that's it for our questions. I'll just go through some concluding remarks, and if there's other questions out there, folks, go ahead and send them, and we'll try to wrap that up. I do have to make a comment, Dr. Brounts. I think it's fascinating that heritability was 25%. It's astounding that the environmental factors are so significant, but I digress. But on behalf of the Fauna Health Committee, Dr. Brounts, we would like to thank you for taking the time to educate our members about this important disease, DSLD. I would also like to thank our members for attending tonight's webinar. This was time well spent. As a reminder, this webinar was recorded and should be added to our library very soon. To view it, just go to www.fauna.com and look for the webinars icon on the home page. If you have additional questions, please submit them to fauna@fauna.com, and we will make sure they're sent to Dr. Brounts for a response. And moving forward, we encourage all of you to join us again. The Health Committee has other pending webinars on topics such as gas colic, nutrition, and barn safety, just to name a few. So with that, thank you all. And have a great night. And I don't see any more follow-up questions, Dr. Brounts, so I think you're getting off scot-free right now. It was very good. Thank you for what you've contributed tonight. We've learned a lot.
Yeah, there's no easy answers.
I see that. Okay, well, good night, everybody. And again, thank you all.